So quiet. Okay, are we okay to get started? Okay, perfect. All right. Any announcements, Desi?
I did not have any announcements unless anyone else in the group does.
I just wanted you to know that I'm here. This is Kayla Nelson. I'm on the phone today.
Hey, Kayla. Excellent. Okay. Well, no announcements. I'm sure we'll get to plenty of content later. We got quite a few items to get through today. So the next thing on the agenda was approval of the November meeting minutes. So I entertain a motion to approve.
Bean moves to approve.
I motion to approve.
Or second.
All right. All those in favor, unmute and say aye.
Aye.
Aye. Aye. Aye.
Any opposed? All right. Okay. So first thing after that is family planning grant. So I think that's Larry.
All right, thank you. Thanks for the opportunity to visit with all of you today to talk to you about our recent family planning grant. Recently, Fargo-Cass Public Health submitted our family planning grant to receive Title X federal funds. These funds are to be used to provide a broad range of family planning and related preventive health services for individuals who may be low income or uninsured in our county. As many of you are aware, Fargo-Cass Public Health has been providing family planning services since 1972. These family planning services assist individuals, assist preventing individuals who do not want to be or get pregnant, or people who want to achieve pregnancy and start their family. Services that this grant will help support include providing contraceptive education, counseling and methods, screening. We screen individuals who come into our clinic for such things as substance abuse, tobacco, mental health, obesity. We have services that center around pre-conception health, and again, individuals who want to become pregnant, they will visit with our providers. We provide a variety of vaccines such as HPV. We do pregnancy testing. We screen for STDs such as HIV, hepatitis C. We do breast and cervical cancer screening, and there's a variety of other services that, again, this grant will help support. These services are provided to individuals. The fees are based on household size and income. Services are voluntary, confidential, and provided regardless of an individual's ability to pay. In 2019, we saw over 3,000 family planning visits in our clinic, so it's a busy clinic for our community, and there's a great need. And even with COVID and some of the initial restrictions due to COVID, we're on pace to see have over 2,500 family planning visits in 2020. We're hoping to expect to hear if we received Title X funding within the next 2 to 3 weeks. We're anticipating approximately $220,000 to come to our clinic. And again, these services are provided to anybody who are seeking family planning services, but geared more emphasis placed on individuals who are low income or uninsured. So once we do find out officially if we do receive the estimated $220,000 dollars, I can make sure to let the Board of Health know. And I appreciate the opportunity because I know in the past the Board of Health has been very supportive of our family planning program here at Fargo-Cass Public Health. And with that, I'm willing to take any questions anybody may have related to our services or the grant related to family planning.
I have a quick question. This is Dr. Newman. Does it include adolescents as well?
It does. The one thing that that some people in our community don't realize, we see a large number of men, women, as well as adolescents. Individuals aged 14 years of age or older can utilize our clinic. And, when that does happen, we strongly encourage parental involvement because we think that's important in the care of the adolescent. But yeah, anybody 14 years of age or older can utilize our services.
Great, that's great. Thank you.
Yes, you're welcome.
Okay. Larry, is that about the same amount of funding that you've received previously or higher?
No, that's about what we received last year. I think we received just over $220,000. There might be a little bit more. There is some talk about adding additional screenings, mental health, depression type screenings that our providers would do, because what research is showing for many individuals, and I've seen as high as 60%, sometimes their family planning provider is the only provider that some individuals will see all year long. So we want to make sure that we don't miss an opportunity. And if we can screen for substance abuse, depression, and other things, we want to make sure we utilize that time with the client. So if I would have to make an educated guess, I would say would be right on track to what we received last year, which would be $220,000.
Okay.
This is Dr. Lavalla. I have another quick question. With the family planning funding, does that allow you to do follow-up visits too if somebody has a baby so that we can screen for postpartum depression?
At this time, what we do is we oftentimes will refer them if they are pregnant, and that's a part of our services, as we provide a great deal of referrals to various community or organizations. So at that time, we oftentimes will refer them to make sure that they have a provider that can take care of their needs throughout their pregnancy and after.
Okay, thank you.
Yep.
Any other questions for Larry? Okay. Thanks, Larry.
Thank you.
We got Anima boarding up next. Grant?
Yes, thank you. Good afternoon, Board of Health members and other staff. I also want to thank you for this opportunity to present one of the newest programs to the Environmental Health Division. And I thought it'd be pertinent to just give you a brief overview of the program and what it pertains. That being said, kind of a time frame associated with this program. It was kind of drawn out a little bit there again because of COVID, but this is a new program for animal boardings for animals in the city of Fargo. But in July of 2019, going way back to then, which seems like an eternity ago, but we had received a complaint about one of the facilities based on cleanliness. And since that wasn't underneath our program, we couldn't do anything. But we found out that the auditor's office actually licensed the animal boarding facilities, but they were operating more of a reactive versus proactive approach. And so if they had a complaint, usually it was about maybe animals fighting or whatever, they would get the PD involved. So we started looking into this and we saw that there was a gap that we could fill because we do have a pet store regulation that's been on the books for many, many years. And so we saw similar parameters that we could incorporate for the boarding facilities. So with that being said, we moved to the next step in October of 19, and we had the commission direct the city attorneys to work with us to look in to develop a new set of requirements for boarding facilities, as well as the ordinance that would accompany those requirements. In order to make sure that we solicited the right input, we invited the industry. I sent out an email to anybody and everybody that could be in the industry. And there again, that was before COVID, so we had a packed house, and a lot of people came and gave us some really good input for this program and what it should pertain and kind of how they saw how it was looking. So that was back in December. We got that, and then we kind of, based on that input and other similar programs from other cities in Minnesota and whatnot, we developed our own set of requirements and parameters, as well as worked with the attorneys to develop an ordinance. So there again, based on COVID, we had a little bit of a setback, but we worked internally to keep the ball rolling, a little slower than usual, but we brought it back to the commission in October, I believe, and then the commission approved it on November 2nd. Then it was published and made effective on November 25th of this year. So we're in the process right now. I'm literally going to send out an email to the places that this pertains to, brick and mortar animal boarding facilities, excuse me, in the city of Fargo. And then we're going to get them a set of requirements. The requirements, basically, they pertain to general facility maintenance, animal care and handling, veterinary care, general housing requirements for the boarding facilities, ambient conditions, you know, the temperature and the conditions for the animals, and then record keeping, which pertains basically to shots. So we're going to get them a set of the finalized requirements as well as an application. The application and the fee is $100 per year. And there again, that's going to cover our proactive inspections. We're going to do at least one annual inspection into each facility. Since it's a new program, we're going to work with each facility to do what's called pre-operational inspection. We'll go in there and really, it's more education and get them licensed, and then tell them about what it pertains and answer their questions and make sure that we can help them to implement our program. So that's kind of to bring you up to speed. That's where we're at. We hope to get all of the facilities licensed in Fargo by the end of January. At this time, I'd welcome any questions. Be happy to answer anything I can for you.
Do you have any questions for Grant? I'm surprised we didn't have much in place before, so sounds like it was needed.
Yeah, well,
I see a furry friend has joined us too, Arlette.
There you go. Perfect. Well, that's what was interesting too, working with our attorney's office. A lot of them have animals, and they said, we thought this was always being done. So everybody wants their dogs to take care of, and the dogs interact with families so they can transfer zoonotic diseases. So it benefits. It's a win-win for everybody.
Yeah, excellent. Right. Thanks for the update, Grant.
You bet.
Okay. All right, COVID updates. I'm guessing vaccine is first on the list and on top of mind.
Yeah, I think we'll actually swap those two and just do a general update first, and then we'll end with vaccines. So we tried really hard not to make this whole meeting about COVID, so just because that's what we've been living. But so just to give you a little bit of an update of where we're at with staff and what we've been doing. So obviously you've seen that our numbers are starting to drift down a little bit, which, you know, we're cautiously optimistic about. I think there's others within city leadership that kind of want us to just jump into normal things again, but we're not quite ready to do that. I think we have to get through the holidays. We have to kind of see where things are going to go. I would like to see us get further into vaccine before we change much of any of our practices at this point. So we are still really busy. Doug's group is busy with logistics, still supporting testing events around, you know, we're still working with long-term care. Long-term care many of them have implemented that second testing during the week as the Binax testing, which is the rapid testing. So that is being done within the facilities, but we are still then doing that second test. I think Cass is still at the twice weekly testing for long-term care due to the numbers. So So they're busy with that. They're still working a lot with NDSU. You know, we have a static site out there and then testing throughout the week. And then we still have the church set up where we have the static site as well. So still a lot of testing going on. Testing numbers are down a little bit throughout the city. I'm not sure, you know, anecdotally, we've heard, you know, many are avoiding testing. So not sure if that's it or, you know, where we're at with that. But now the Binax testing, they really are, there's 2.4 million Binax testing coming into North Dakota. So the state is pushing pretty heavily on anybody and everyone that will test. So they are going to be partnering with some various businesses, different things, you know, obviously the schools and shelters, and there's already many community agencies that have those capabilities now. They get training and then they're able to kind of spearhead those events themselves. So we have that going a lot. We have our contact tracing operation still, which is ongoing. The state has now went back to full contact tracing again. So the interview time is taking longer again, even though our numbers are down, the time is increased for the time that they speak to those individuals. So we'll just have to kind of play that by ear for staffing. You know, we have that support through the end of the year for funding for contact tracing and then a little bit into 2021, but we didn't really want to do anything with staff at this point because we're just not really sure what's going to happen with our numbers and just wanted to get a little bit of a better handle on it before we would decide to either decrease staff or repurpose staff. So that's kind of what we'll be doing with that. We have Jan's group who's working with the Q&I shelter downtown in the old Fargo PD building that they have been working to orchestrate that. So that has been helpful. Obviously, you know, the main funding for us runs out at the end of the year. We still really haven't gotten any indication as to what will happen for 2021. We have a little bit of funds from the disease control at the state to go for maybe the first few months into 2021. Obviously, the city has given us reassurance that they will support whatever we need to support for ongoing pandemic response. So we'll just kind of have to wait and see what happens. We have our National Guard support that was obviously continued federally, so that will go now through the end of March. So that was helpful to maintain some of our staffing resources. Yes, which then environmental health has still been working with, you know, any business complaints on the, if we get any mask mandate, you know, infractions, you know, either through PD or through, you know, community reaching out and voicing complaints, they will go and investigate and meet with business owners and do education based on, you know, what the current rules and guidance is at this point. So I think that's been working well in partnership with PD. Yeah, and then that would bring us to vaccine, which I will say that Hunter Hubrig, who's on our EPR staff, and Suzanne and many others have spent, you know, enormous amounts of time trying to coordinate the vaccine piece of it. I can't say any of it has been easy for them. You know, it's been a lot of details, a lot of things that change very rapidly all the time. You know, we put in numbers based on numbers we got from community members. Many are doing their own. They've registered to be a provider so that they could give vaccines to some of the larger health systems and some of almost all of the long-term care. Hunter worked closely with them to get them signed up so they could either partner with one of the CVS or Thrifty pharmacies and then or do it themselves. So that has been good. So we don't have any long-term care that we're actually doing. So we will kind of, our first groups will be those first responder EMS groups, but also we are only getting, our first allocation is going to be 300 doses, which is not going to go super far. So that's going to be some of our challenges. They've also, you know, initially police was not included in our upper 1A tier, and now that has been moved to that. So they do a lot of changes, either based on ACIP or the state, and then that kind of changes all of the planning efforts that have happened. So those then all need to be readjusted. So it's been a big effort. And Suzanne, if there's anything, not to put you on the spot, but if there's anything else that you want to add just on how maybe timeframes that you know better of, if you want to speak to some of that.
Timeframes as far as vaccine arrival.
Yep.
So we are expecting to find out hopefully today or at least for this weekend when our shipment of Moderna is on its way. We are planning to, Desi mentioned those tier 1A people that we will be starting with, and we are planning to start them on Tuesday. And so to do Tuesday and Wednesday, they are being invited specifically to our site to receive vaccine based on the scheduling that we have. We were also told, as we are not a facility that is vaccinating long-term care facilities, because they're going to be working through a contract with another pharmacy, we should prepare ourselves to not receive vaccine the week of the 27th or the week of January 4th. So there's a high likelihood that we will receive this first round of vaccine next week, and then we will not receive vaccine again until the week of January 11th. We're hopeful that in between we get something, but we are prepared, as they told us to be, and we may not. So that's kind of where timing is with that.
And one of the challenges we will probably have, for those of you that were around with H1N1, of course, due to our population in numbers and casts, our allocations seem to don't seem to get through the populations as quickly as some of the smaller counties perhaps around us. So when we did H1N1, we would be still in that first priority group, whereas some of the other counties around us would be already in the third or fourth priority groups. And so people ended up driving around the state to see where they could get vaccine. So we kind of suspect that we may have some of those same issues because our allocations so far for casts seem a little bit on the lower end. And so I think we will have some of those challenges. Obviously, Suzanne and Hunter are very busy taking phone calls from those who think they should be moved ahead of other people in the community. And so it's all of that comes when you get into these priority groups and a limited supply. So we will just do the best we can to meet the needs. And certainly we are going to stay within the guidance that we have been given, and we will just have to communicate that clearly when we are called to task on that. So is there any questions that anybody has or things that we didn't cover, or that you have questions about from other COVID response, anything else?
Desi, this is Arlette. Oh, this is Arlette. Sorry. So am I understanding this right, that we are only getting 300 vaccines between now and middle of January? Is that right?
That is potentially correct. So
Wow.
we have 300 doses that we know are coming next week. But yes, because we are not doing long-term care, it potentially could be a couple weeks that we don't get vaccine, and then we get some that, the third week after. So, yep, it could be a bit of a challenge. And then since they had moved, the police department, they just moved those last week, right, Suzanne?
That was yesterday.
Yesterday, sorry, lost track of time. So because of that, we didn't include them in our allocation numbers. And so then that just adds more to that, first dose that we have to get through. And the 300 is not going to get us through even the initial group that we had. And so, yeah, it's going to be a little bit of a waiting game, and there's just lots of things to keep track of. And then, you have the storage issues that you want to make sure you use the vaccine that you have. And I think that's a little bit of our frustration as well, is that some of the smaller counties, we've, heard under the radar that they're like wondering what they're going to do with their allocations because they have more than they need. And so there's always challenges that way where we're like, yes, we would have loved to have had. I think Suzanne said we requested 600 for our initial round just to get started, and we ended up getting 300. So it is what it is. We'll just have to do the best we can. But yes, there will be some unhappy people who may not understand the process going forward.
If I could just ask.
Anticipate only getting Moderna, or is there a chance you would get Pfizer vaccine as well?
At this point, Suzanne, we're only supposed to get Moderna right now, right? For what we've been.
The initial allocation we received is Moderna only. We are prepared to receive Pfizer, and we're being told to be prepared. So we are policing for it, and we are going to have that practice in place for the storage, because the storage of that one is, of course, much more difficult. So we have all that in place, but as of right now, we are just getting Moderna, planning to receive Pfizer in the future.
This is Lynn Telford. So the doses that went to some of the smaller counties, were those Moderna as well?
Yes, I believe so.
Okay, and then assuming that there's some sort of statewide effort to coordinate those extras, since we don't want any to go to waste.
Yes, so there is a plan in place that if we need to coordinate transfer, they can be transferred. The beauty of the Moderna is that once we get it, of course, once everything goes through, they submitted to have a 30-day window within the refrigerator, the refrigerator status. So many of those small counties may not need an allocation moving forward. So we may be able to gain even just that way by they can maintain it for 30 days in their fridge, and we can get those allocations. So I kind of suspect that after we get through this first piece, honestly, I expect once we get through long-term care staff and residents, we'll start to see a little bit better flow and more consistent allocations. I think it's just this initial push for long-term care. And because we are not actually doing that piece of it, we're just not seeing as much.
Desi, this is Rick Steen. If I may. A question for you, Desi. You referred to the police department will be now considered part of that tier 1. Does that include all law enforcement or just the city police department?
I think that's, Suzanne, maybe you know best. I think it would be all law enforcement, wouldn't it?
Yep, it will include all law enforcement. And Hunter has reached out once we got that message yesterday that was happening, because we had been in contact with the sheriff's office, city police in West Fargo and city of Fargo. He did reach out to them to let them know, actually, before it went out public from the DOH, we just let them know that what we had told them before had changed. So yes, they're all, those 3 law enforcement agencies are aware of the change.
All right, thank you.
You're welcome.
This is Kayla Nelson. So are those 300 doses going to cover like your public health nursing staff as well?
The 300 doses will cover part of that initial tier 1A includes the vaccinators. So those that are doing the vaccinations at the facility that we're going to be performing at, and then or administering at, and then the other tiers in there. So that includes EMS, fire, some of the clinics. Public health will not be, the grand scheme of public health will not be in that first 300 doses. Public health is in phase 1A, but that is the 5th tier of the tiers within that phase by the state.
I just think of like a lot of the nurses that are going out and caring for my high risk patients, like my Nepali patients and that kind of thing. They're still out in their house, so I wasn't sure if they were included in that.
So technically the home health group will be in, I believe, and this is off memory because I don't have it in front of me, but I believe the home health staff will be getting it under phase 1B or tier 1B, which is the same as long-term care staff and residents are as well. However, because law enforcement has now been bumped to tier 1A above them, we have to shift all of those doses down, kind of trickle down to get to them. So it's going to take a little bit to get to them.
Sounds good.
This is Arlette again. In regards to the number of doses that have been allocated to the community, do we have a sense of what the total number to providers and everyone else? I'm assuming the 300 is just public health.
Yes, the 300 is just Fargo Cass Public Health.
I think wasn't the initial shipment to North Dakota 6,000 and some, Suzanne, that came?
The initial dose of Pfizer was 6,825. And then I can't remember the Pfizer that's coming next week, but I want to say it was around the 7,000. And then Moderna was going to be 13,200 for the state.
So do we know how many were allocated to Fargo Cass? Total, I mean, with providers and everybody else.
I don't have that at the top of my head, but I might have it here in my notes. I can just take a quick peek.
Other questions?
This is Pearl. Where would we find the tiers published? Is that published someplace? I just did a quick Google search. I couldn't find it, so that's why I'm asking.
It should be on the North Dakota Department of Health.
Okay,
website.
So apparently I'm not good at running my Google. My second question is maybe a little self-serving for my department at the county, but was there any consideration about human service staff who still have requirements for community visits? I'm thinking specifically like our child welfare staff who are required to go into the community and where they might fall into the scheme of things. You know, I've fielded a few questions from my staff, and so just wondering where we might fit in that picture if it's not, you know, specifically spelled out in the planning phase.
Would this be primarily like social workers and other kind of public health out in the community?
Like we have like CPS workers and other social workers who are providing in-home services to children and families in the child welfare system.
We have, Hunter has reached out to the Cass County Social Services, or however it's set up now, Human Service Division, or however that's set up. He has reached out, but I don't know that he's gotten any information back yet.
Okay.
And I think some of the Cass County stuff was being kind of filtered through Cindy Stoic a little bit at Human Resources.
Okay, that sounds good. I'll follow up with Cindy. I know her well. So I just hadn't heard anything. And so as the director of the Human Service Zone, you know, not saying that stuff is magically going to get to me just by virtue of my position, but I hadn't heard anything yet. So just curious. Thank you.
I know we're running a little bit past time. Are there other quick questions that anybody has?
Actually, we're scheduled for an hour, Chelsea, if we need it.
Oh, are we? Oh,
yeah.
I'm sorry. It only came across as a half hour on my calendar. So, okay. Good.
Desi, I have a question for you, a follow-up question on the testing. When you said it's down a little bit, can you give me a percentage? Approximately?
Oh gosh, I don't know if I can. We probably can figure that out and send it to you. I know Justin keeps all those stats, but I don't know if he knows them offhand either. But
okay.
I can tell you, we've been still running about 20% of state testing. I would have to do total tests, and I can get that back to you in like, give me an hour or so.
Okay, thank you.
This is Chelsea. I just have a quick question on the allocation piece. Is it the state health department that's determining which counties get what amount of vaccine, or who's making that determination?
I believe that would be a disease control thing, yes.
Okay. Okay. Just curious what their formula is, if we're getting
well,
similar.
and we have, I know Suzanne and Hunter have been really trying really hard to be a little bit vocal and to, you know, if things change, to reach out and to ask questions and to ask, question the allocations and to try to get more. And so I think they're doing everything they can on their part. It's just, at the end of the day, it kind of comes down to what they send us.
Okay. Interesting. Okay. Other questions on COVID? Okay. Everybody is ready for the holidays next week, maybe. All right. I think the meeting schedule for next year is the next thing on the agenda. Sorry, my computer is done for the week apparently, so I lost my computer connection there.
And I believe Lori sent those dates out, correct, Lori? So everybody should have had them. Is that agreeable to everyone? Does that look like that schedule will work for everyone? Kind of try to stay along the same time frame every year, so we're not making it too complicated. And obviously, if we need to add in, like we did, last month, we can do that as well as things come up.
Yeah, it looks like every other month, like we had been doing, but yeah, to Desi's point, if we can add in between, we fit that in. So, anybody have any modifications to the meeting schedule? If not, I'd entertain a motion to accept, because I think we need to formally approve.
This is Rick. Just two items there. The schedule looks fine to me. However, this is my last meeting, and my portfolio assignment will be shifted like we do almost every year. And so the incoming county commissioner is Commissioner Dwayne Breitling, and he will start in January. But I'll move to approve the proposed meeting schedule.
Perfect. Thank you, Rick.
Second.
Have a second. All right. All those in favor, say aye.
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 Any opposed? All right. Well, it looks like we got our meeting scheduled, and thanks, Rick, for your time.
I appreciate the opportunity. Very informative. Thank you.
Yeah. Excellent. Any other miscellaneous items that we need to touch on today, since we have time?
Well, I'll just share to the public watching if there's any vaccine hesitation. I personally received mine on Wednesday, and I feel completely fine. I felt normal for 2 days, just a little arm soreness. So please go out and get your vaccine.
Excellent.
Yeah, we have been doing some efforts to, with the city of Fargo. We're going to be doing some stuff with our employees, with the city of West Fargo. I think we've done some work with the schools just to kind of help with that vaccine education and to encourage as many as we can to get vaccinated. I know Dr. Carson and his group have worked with WDAY to do some TV spots, some news stories on vaccines. So yeah, our hope is too that there isn't the degree of vaccine hesitancy that we, anecdotally hear, but yeah, hopefully it'll go well.
I know from experience with both healthcare organizations, there's a really good turnout for the frontline caregivers showing up, which is just really hopeful. It gives me hope that we will continue that. So I think we have healthcare workers setting really good examples, and they're sharing those stories. And thank you, Dr. Newman, for sharing that and letting people know that you're feeling okay. I think that it's new and it can be scary, but I think our frontline healthcare workers are stepping up to the plate and setting the example. So hopefully the next few months will look more bright.
Now, what about those anti-vaxxers? How do we get them on board?
Public education.
Yes, definitely. well. And, you know, I was encouraged to hear some of the flu influenza vaccination rates this year being better. Not sure that it's up near where we would like it to be, but hopefully that is a good sign. And, you know, I think folks want to go back to normal. And so hopefully they're open to learning more about the vaccine than maybe they had been previously, given the destruction that this has caused. So I agree, public education will definitely be a part of it, and having our healthcare providers like Dr. Newman's kind of step forward and talk about your experience, I think is very valuable, as Lynn had indicated. So, but if there's anything that we can do, Desi, in terms of educational campaigns, please let us know. Certainly an important effort.
Yeah, absolutely, I will.
Okay. Anything else from the group today? If not, I'll give you some time back, and everybody have a healthy and happy holidays, and we'll see you in February.
Merry Christmas,
All
everyone.
right.
Thanks, everyone.